COVID-19 belongs to coronavirus family. Examples of this family include SARS and MERS. Due to its specific viral structure, COVID-19 viruses have particular receptors which specifically bind with lower respiratory system. In patients diagnosed with chronic respiratory diseases such as asthma, chronic bronchitis, and emphysema, they are more susceptible to this virus. COVID-19 viruses are thought to be transmitted by droplets in the air. In patients without respiratory disease, symptoms usually involve upper respiratory tract, such as sneeze, sore throat, and runny nose. But in patients with chronic respiratory disease, viruses aggravate underlying conditions, resulting in more serious manifestations such as pneumonia and respiratory failure. That is the reason why patients with chronic respiratory diseases are at greater risk of death. COVID-19 disease causes a wide range of symptoms, ranging from mild to severe conditions. Mild symptoms are similar to common cold, which include sneeze, cough, and runny nose. In severe cases, patients develop pneumonia and ARDS, acute respiratory distress syndrome, which is life-threatening condition. During patients are developing pneumonia or ARDS, lung tissues might be irreversibly damaged. As a consequence, lung fibrosis occurs and lung functions are then impaired. Recently, based on medical evidence, there is no definite treatment for COVID-19 disease. Principal treatment is symptomatic approach, depending on symptoms and disease severity. In patients presenting with cold symptoms, treatments involve antihistamine drugs, cough suppressants, and antipyretic drugs if fever presents. In severe cases, intensive care approach is required, including oxygen therapy, ventilatory support, or even ECMO, extracorporeal membrane oxygenation, to replace impaired lung functions while waiting for recovery. Regarding current clinical researches, medications that have been used to treat COVID-19 disease are anti-malarial drugs combined with certain antiviral medicines. In addition, a number of clinical trials have been conducted to find alternative treatments and prevention against the disease, such as monoclonal antibody drugs, as well as vaccines. For patients with chronic respiratory diseases, if symptoms are worsening, immediate medical assistance must be sought. Besides general prevention measures, scientific evidence strongly suggests that COVID-19 viruses can be spreading through any forms of cigarette smoking. More importantly, social distancing must be strictly complied, especially in patients with respiratory diseases who are more susceptible to have severe symptoms if infected with COVID-19.